Hello, I'm Dr. Brandt Gibson, and one of the other problems that we have with children's feet are ingrown toenails. And with ingrown toenails, there are some of the exact same treatment options that we have with adults, and we'll go back into those in a second. But what I'd like to do is start with infants or newborns and an ingrown toenail. There are some individuals, some infants that are brought in within the first weeks of life because they have an infected ingrown toenail from birth. And what do you do for those? Because they're not treated the same. Well, with an infant, the nails are so soft that most of the time we won't put the infant through numbing or anything that's more permanent. We literally just take a portion of that nail out, and it's so simple and so quick and minimally painful. It doesn't hurt so bad that the infant can't handle it. They usually get pretty mad and then it's over. So we treat ingrown toenails differently in that case because of the softness of the nails. Otherwise, in children, the treating of an ingrown toenail can be very, very similar. And my recommendation, probably 95, maybe even 98% of the time, is if you have an ingrown toenail that you treat it in a way so that it does not come back. So the first way that you can treat it is basically trimming a corner of that nail, trimming this out more distally, more at the tip of the toe, by taking the corner of the nail out, and then that will help solve the problem. The other way, which is the preferred way and the recommended way that I will usually talk about, is doing a more of a permanent nail removal, which means you numb the toe up, you actually take a sliver or portion of the nail out, and then we use something to kill that nail bed, whether it's phenol, creating a chemical burn, or whether it's doing a surgical resection to fix the problem. The point here is, if you have a nail where the edge of the nail is growing into the skin, the best way to treat it is to trim that nail out, kill it so it doesn't come back, and 99% of the time you will not have that problem again on that side of that nail. So if you have a child and they have an ingrown toenail, typically we'll treat them very, very similar to we do if you had an ingrown toenail, where we numb the toe up, take a piece of the nail out, kill it so that it doesn't come back, truly solving this problem so they don't have to suffer with it every couple months or a couple times a year or whatever, because this will keep coming back in most cases, which is why you want to just treat it. This is Dr. Brandt Gibson. These are Podiatry Tips Day 306, ingrown toenails in children.